Two. Good afternoon, everyone. Welcome to HBI 2021 Domiciliary Care Panel. COVID highlighted the safety and the effectiveness of domiciliary care. 2021 was a solid period, and the hike in demand is expected to continue as more and more people want to age well at home. M&A is picking up, and the sector is attracting interest from tech home care groups and moving from a traditional home care model into a more personalized and technology-driven one. With me today, I'm delighted to welcome an expert panel ready to answer all these questions and much more. James Thorburn leads City and County Healthcare Group, the largest provider of home care services in the UK. City and County provides community-based care to people in their own homes. The business operates in over 200 locations and provides nearly 60,000 hours of care every day. Thank you, James, for joining us today. Dr. Ben Matharapu is the CEO and co-founder of Seracare, a London-based technology-enabled home care company and one of the largest social care providers in the UK. Seracare allows families to arrange and manage home care for relatives and uses a digital platform to match people seeking home assistance with carers. Thank you, Ben, for being here. Guillaume Richard is the president and founder of WeCare Group, which gathers a dozen of companies providing home services such as house cleaning, childcare, old people care, gardening. WeCare operates mainly in France with some brands like O2, APEF, France presence, but also in Spain, Portugal, and Mexico under the brand Interdomicilio, and employs around 20,000 people. Thank you, Guillaume, for being here today. Our final panelist is Thomas Brzezinski. Since 2011, Thomas has been involved with ProMedica 24 Group, taking positions of CFO, member of the managing board, successively as vice president of the management board, and since December 2019 as a CEO and CFO. ProMedica 24 Group is a pan-European home care provider with presence in Germany, England, and Poland. Thank you, Thomas, for being here. I'm going to start this session with a COVID-related question. We see that the impact of COVID on nursing homes improved actually the visibility and reputation of home care. What does this mean for domiciliary care market in general and investor interest in particular? And will this growth continue once the nursing home market recovers? James, would you like to go first?
Yes, of course. So I think for an investor, the impact of COVID has actually accelerated many of the trends that investors were already approaching the market for. I think firstly, we do see a pivoting of strategies from residential settings to better use community settings as public health budgets are under such pressure. And where the acuity allows, you can more cost effectively provide service in the community, and you can do that faster because you don't have to set up hospitals and buildings to do that. And so I think policymakers faced with pressurized budgets, higher demands from citizens, and just increased costs within healthcare are pushing more towards community care. And I think COVID has accelerated that trend. I think it was also accelerated by the fact that care homes and hospital-acquired infections, that care homes were so adversely impacted by COVID due to infection spreading. And as the data is beginning to come out, actually so many people in hospital actually didn't go into hospital with COVID who died in hospital. A significant proportion caught it in hospital. So I think that's also driving a favorable drive towards community care as well. And I think the other area that you suggested is sort of technology and data. So I think everyone realized in the UK certainly that suddenly in the response to the pandemic, actually there wasn't good data available in community care. There weren't joined up systems, there aren't systems for providing that community care. The social care market is very fragmented, and there was no way actually for people to really understand what was going on in community care. And I think that really revealed to the NHS and revealed to policymakers that actually this is quite a problem if you're going to pursue a joined up healthcare model, which I think increasingly we're seeing in that direction of travel. So I think those things are all good for community care and good for investors in community care. And so I think it's accelerated positive trends that were happening anyway.
Mm-hmm. Thank you, James. Ben, do you agree? And actually, I would like to hear from you. You recently expanded in nursing services, right? So how will nursing homes recovery may impact your new plans?
So I completely agree with everything that's been said. I think if we look over the past 10 years, in general, there has been a shift from hospital, care homes, and nursing home facilities into the home. Many studies already show that people feel more satisfied there, they receive better outcomes, and it's more affordable. And of course, in systems, health and care systems that have pressures, that have surplus of demand, that have also cost challenges, it seems the clear choice going forward. As we heard, COVID accelerated that movement quite dramatically. And yes, care home and nursing home utilization may improve compared to what's happened in recent months where there have been some particular difficulties. Nevertheless, though, I think if we look on a 5-10 year horizon, the direction of travel towards the home is very clear. And I think absolutely that's the case for care workers, but I think that's the case for other services too. And if we combine that with the digital point, so many of us now are used to monitoring respective health conditions or even tracking COVID in our own homes using our smartphone, requesting testing kits, logging that online, using the NHS app sometimes. I think we're becoming acclimatized to it, which cements the position of more and more services in health and care in a domiciliary or home context.
Mm-hmm. How about my question about your new services? Yes. Do you think this new trend is going to impact your plans?
Yeah, I think one of the reasons was that we decided to move into nursing services as well is because it complements what care workers do quite neatly. Many people who need domiciliary care do in turn need nurses to come and visit them for, let's say, wound management or support with chronic diseases, or if they are receiving palliative care services or complex care services and a whole host of others. So we do see it as complementary and very cost effective for the health and care system in general, which was a driver behind moving into and expanding into nursing services.
Mm-hmm. Thank you. Guillaume, how about France?
I think there's exactly the same thing happening in France as it is in every country. People mostly want to live and grow old in their personal homes. So they don't want to, mainly there were surveys saying that more than 90% of the people want to stay at home the longest possible. And so we need to, and this was reinforced by the COVID. And nowadays, when you are asking people, would you send your old parents to a collective house or whatever facility, they're saying, no, I don't want. Because there were many, many, many cases of COVID over there. And in France, it was half the people who died in the EHPAD. So would you send your old mom or your old dad to that place? No, you do. So if you don't have any other choice, then you do it. But now we have many, many ways to provide highly secured solutions to have the people staying at their homes. We have all the Geron technologies, which are technologies designed for old people that enables to have a secured home that to monitor how the people are doing, and we can just provide services, provide refurbishing of the homes in order for the home to be to the personal home to be much more secured, like changing the bathroom, changing the having some some automatic lights system or whatsoever, and all the Geron technologies that will help to monitor whether the old people living has been opening the fridge, has full or not, has the everything. So you can secure the home of the old people. So if they can stay at home, then they want to stay at home mainly. And we also need to be able to, because if this is the what 90% of the population is asking for, there are 10% that is asking for to be able to live in a community. So I guess there are the different kind of market, but there is a very, very, very huge demand to stay at home.
Mm-hmm. Thank you, and thanks for bringing the technology issue on the table. It's very interesting.
Which is something very new. Which is something very new, because when you before, when you had old people that had cognitive problems, like going errand or somewhere, you didn't have any choice but to put that old people into a place where he or she was safe. But now you can have the Geron technologies, you can have things on your neck or watches, special watches that will be able to track you. So if you get lost, we can find you back and things like that. There are many, many, many technologies. It's just one of them, but there are many, many technologies, and this can make your personal home a safe place as well.
Mm-hmm. We're gonna come back to the technology topics later on. How about you, Thomas? Do you agree with the rest of the panel?
So first of all, good afternoon, everyone. It's nice to see you here on this third day of the conference. So actually, living care was becoming more and more popular even before the pandemic. And actually, in countries like Germany, it was popular even before the pandemic. What James said and what the guy said, that COVID accelerated the trend, and it showed that the service can be very safe because it's flexible. So first of all, you have the gate at the entrance, which is testing, and then you can manage the number of contacts with external parties, with third parties, which significantly limit the risks of getting infected. So for example, in our case, in the recent 18 months, we've had just 3 COVID cases, all managed according to the government guidance here in UK. So it shows that this is the safe service. A few years ago, a study made in Germany showed that when you ask a 60-year-old person, 80% of them prefer to stay at home. If you ask a 70-year-old person, 90% prefer to stay at home. That shows that this service is really attractive. Also, the market as such is growing every day because it's about demography, it's about aging structure, it's about baby boomers just coming to the age when they will need help. So all those factors show that this service, there's future in this service. So if you are asking about investors, they should be excited.
Mm-hmm. Thank you, Thomas. And speaking about the rising demand, how is supply? Did you see your churn rates rising or falling? And how do you deal with the critical staff shortages, especially here in the UK, after the mandatory vaccination, Brexit, and all the trending issues at the moment? James, would you like to?
Yeah, so honestly, staffing is one of our biggest challenges. This is a market that has no problem on the demand side. There are unmet needs lists and people who can't get care and people who need to get out of hospital everywhere. so really our main constraint on our business is our ability to attract and retain care workers, and that has actually this summer that our staffing actually got quite acutely more challenging actually. Really, it was pretty much okay for the first half of the year, but actually this summer we saw a whole range of different factors come to play. Sort of workforce, pent-up holidays. Summer is always a difficult time because people tend to go on holiday or they have their kids at home. And we also saw some people leaving the industry as well, sort of life choices after COVID, and a real squeeze in the recruitment market, which is quite well publicized in the UK. I think we're probably through the worst of that, and actually early September is looking much better. But that probably is one of our biggest challenges. And mandatory vaccination is a really good question. I mean, I think inevitably that will drive some people out of the workforce, especially where in the UK government policy is sometimes a little more half-heartedly followed than wholly followed. So in France, when you go to a restaurant, you need to show your COVID vaccination, so they're all in. And the government is clearly pursuing that policy. In the UK, we tend to sort of, we'll make it mandatory for healthcare workers, but with sort of other people over the age of 50, but we might not for other people make it mandatory. So I think in that context, we'll definitely have a staffing pressure if mandatory vaccination comes in. But as always, we'll deal with that, and I think there's a demand out there at the moment that needs to be satisfied, and that's a challenge that we'll need to rise to.
Thank you, James. Ben, do you agree with James?
Yes, I think so. As James said, this is an industry and a sector where there is surplus of demand compared to the availability of frontline staff, and that I think is the case for all of healthcare. As lockdown eased over Easter, I think every sector in this country, and if you look at other countries too, opened up and started recruiting very assertively, because in many cases, businesses in hospitality, retail, leisure, and so on had unfortunately let go of staff, and so they had to get back to normal levels, but also cope with the increased demands because people were outgoing much more than arguably pre-COVID levels in some cases because of staycations and so on. And that meant that the jobs market across the board, I think for everyone, especially if I talk to colleagues in fintech or who are working in insurance or completely different industries, they are experiencing recruitment challenges. And I think that has definitely been the same in health and care, and specifically home care as well. But to James's point, now that we're past summer, which means less people on holidays who are on the front line of care, but also other industries where they've had to have extra staffing to deal with some of the summer holidays and the increased demand in hotels and so on. That means the jobs market is changing. People will come back from furlough. That's going to be over 1 million people as well. All of this means that I think some of the pressures that have been on the recruitment retention side will be alleviating. That being said, the past year, because of the pandemic, past year and a half, has been really difficult for anyone who's worked in healthcare. And it's very important to recognize that and to ensure that people are getting the right support and empowerment. Otherwise, risks of staff burnout is real. And it's important to mitigate and to manage that because it's been a 12 to 18 months, unlike any other, I would argue, in the past years or decades of health and social care.
Mm-hmm. Thank you, Ben. Is it the same in France, Guillaume?
Obviously it is. And it's even worse because we have vaccination which is compulsory in France. Mm-hmm. All our staff has to be vaccinated. So that was quite an issue, huh? And this is quite an issue. But that's why our vision, the group vision, is to become the world leader, the company that in the world takes more attention to its employees and its customers. And in that order, employees first, because if you have employees that are happy in their jobs, then you have 99% of chances that your customers will be happy, because if you have happy employees, then they are doing good jobs. And the key point in our business is to have the right staff, the good people. That is much more difficult to get a good employee than a good customer. Customers, you have lots of them. Employees, good employees, that's very difficult. So you need to work on everything. You need to work on work conditions. You need to work on global income, which is not only the salary, but also the cost, because our employees, they are going to the homes of our customers. So they have potentially a high number of kilometers every day to go to one home to another and to move from one to another. So if you are managing to do optimizing their plannings, it's very, very important. What kind of other advantages you can give them? And so you need to think about the whole way of providing the best possible job to your carers. How you can improve their life, how you can make them happy with their professional life. And that's why I'm saying to all my managers, your job is to make your employees happy. Mm-hmm. You are a chief happiness manager of carers, because if they are happy in their jobs, then our customers will be happy. So you need to work really hard on having employees that are happy with their jobs. They have the right, the exact number of hours they want to work, because many of them, they don't want to work full hours. They have the minimum number of kilometers from you have to lower the distance between their homes and the homes of our customers. You have to work on their global income. You have to work on being able to give them evolution opportunities for those of them who want to have these kind of evolutions. You need to everything work on the working conditions of your carer.
So these are the strategies you follow to attract and retain your staff, right?
Absolutely. This is where we are putting the most of our energy. It's on attracting and retaining the best carers, the best employees. That's why we are proposing them either to be fully employees of the company or being employees of the direct of the old people, or to be self-employed, or to be. We have different kind of things. We are proposing them. We have different kind of value proposal in the dozen of companies in the group, because they can be in different kind of contract relation with us, so that they sometimes they have more security, sometimes they have more freedom, sometimes they have more income, sometimes. So they are very different kind of value proposal for our employees.
Very interesting. Thomas, how about you?
So actually, the interesting phenomenon which we observed in the beginning of the pandemic was that the churn rate decreased, and there was increased interest in our service, in working for us. That was because the care personnel looked for certainty, safety, legality, things like this. So this is what we could offer. And I fully agree with Gilles that we have two types of clients as such and care personnel. This is very important to care for the care personnel. And when I look back a few years ago, we are in a totally different situation right now. we provide many additional benefits, making this job more attractive. We take care about all the logistics, all the formalities, all the legal aspects, all the papers. So we provide 24 hours contact to our care personnel, support. They can, if they have questions, they can just call any time of the day or night. They are supervised by care managers just to make sure that the service is provided properly. So this is the key asset that we have. Of course, as well the key cost element. But it's not only it's not only about the money, about going to other businesses. We have to care for them, and this way we are able to keep them in the company.
How about wages increase?
This is just the fact. We have been observing this for years, and it's a fact. You just have to live with this. And on one hand, you have to provide the extra benefits, which you can, by the way, optimize on the company level, provide them in an efficient way, in a more efficient way than an individual, and with the company growth, you can optimize elsewhere. Yes, you can. I think that all of our companies are severely digitalized because there is no other way around. So you can look for the cost optimization in other lines of P&L.
Mm-hmm. Thank you, Thomas. We've got a question from the floor. Rachel Lewis from HBI actually asks, people say that they want to stay at home, but what if they are unable to do so? Is there a reputational risk if bad things happen to patients while they are being monitored and cared for at home?
Sure.
Who would like to go first?
I may start because that's a very good question. And actually, in UK, we have CQC, Care Quality Commission, who supervises the service. So you need to have an adequate structure in place. You need to have the care managers. You need to have the documentation, and this documentation is very important. If there is no documentation for CQC, there is no service. Yes, so it's strictly supervised, and of course, at some point, an elderly person may require more specialized care, may require to go to the hospital. But right now, the problem is different. There are too many people in hospitals, and actually what we face is that local authorities tend to approach us and buy our service, because buying our service is 4 or 5 times cheaper than keeping the person in the hospital, the person that does not need hospital help.
Mm-hmm. James, do you agree?
I mean, the simple answer is yes. I doubt there's anyone on this panel that doesn't have sleepless nights worrying about reputational risk, and it's not really about the reputation, it's about just poor care provided to someone. So look, I mean, this in this industry, you know, you need to have really good quality management systems. You need to, we're investing a lot in IT because there's a lot of IT opportunity to improve care quality and the way that you manage that. And you have to go through all the regulatory requirements as well to ensure that that's the case. So, I mean, the simple answer is, yes, that's an ever-present thing that everyone in the business will be sweating over. And if they're not sweating it over it, I want to know why.
Kim?
There is obviously a risk. I mean, we are human and we are employing humans that are providing services to humans. So risk is everywhere. And what we are doing is that we are maximizing the reduction of the risk by having quality measures, by training our employees, by monitoring the quality of our services. But as you said, we are doing old people care, but we are also doing child care. And when you're dealing with a child, it's even more risky. And we are providing more than 1 million services each year. So everything that has a 1 out of 1 million chance to happen, happens. So I had pedophilia, I had everything you can imagine. Everything that can happen happened. But then, when you have a case, so you are analyzing what happened. Did you do everything that was required? Yes. If you did everything that has been required, I told you I had one case of pedophilia, but everything that we had to do, we did everything. We did all the checks, we did everything, we had all the processes. But then you're not in the mind of the people. And this guy, he switched. And the family, they were not angry against us because they said, okay, you did everything. And this guy has been working more than 20 years in the child industry. He has been doing everything perfect during 20 years. You had all the record. You had checked all his past experiences. You had done everything that you could have done. And then it's human risk. So
I think the question is more focused to the elderly care, but yeah, definitely.
but that's it's exactly the same thing. Mm-hmm. But it's often...
It is related.
Yes, so that's the same kind of risk.
Ben?
I think, so on the first part, which is if people say they want to stay at home but they're unable, while the majority of people can be looked after at home, there is a minority because of the severity of their condition, or let's say their home doesn't have the right setup. It means that it's more appropriate for them to be looked after in a different setting. And then in terms of reputational risk, if bad things happen, I would turn that around and say, name me an industry or company where there isn't a reputational risk if bad things happen. It could be Pret having incorrect mayo. It could be Samsung with phones that don't operate correctly, or Apple that has data privacy issues, or cars which have to be recalled for whatever reason. I think every industry, and you probably heard that in different guises from the responses, every industry has reputational risk if things go wrong. I think the key is having the right processes in place to ensure you minimize that risk, and you can monitor if and when things go wrong to ensure that at least the company and the organization did all the things that it could to avoid that issue from happening in the first place, per what the regulator would be requiring and beyond.
Thank you, Ben. Do we have any other questions from the floor, maybe?
And just to complete my answer, we have texts that help us. For example, every time one of our carer arrives at home, he scan a QR code, so we know that the carer is arrived. So we know that whenever there is an old people that needs assistance, if the carer has not arrived, we know it. And so we can provide somebody else. So there are lots of texts that are helping us also to be able to
I'll come back to the
minimize
technology
the risk.
topic later on. I think we had a question from the floor.
Yeah, so I think we all agree the demand is there, as you said, for your industry, and same for residential. And the limiting factor, as some of you said, are the staff availability, one of the limiting factors actually to scale. Given the scarcity and the arms race to actually recruit and retain people, and the translation into wage inflation, which one of you said you have to live with it, how you balance that versus recovering that from your end patient or payer versus, let's say, the financial aspect and your margins? In other words, wage inflation versus margin erosion. That's the question.
I mean, happy to answer that. So what we found in the UK is that obviously with national living wage and other increases, inflation is not a new thing to us. It could be even more acute this year, but there is a process, a really well-established process with local authorities and CCGs. Private market is slightly different, but the public sector commission market, that every year our charge rates are adjusted. And this is quite an important thing in terms of the investment profile for the sector, because effectively, as quite a, for us as a very cash generative business, we don't have property assets and we're asset light. We're effectively a sort of index linked, inflation, because our charge rates go up to cover the costs. The cost increase, and that's really well established year on year for us. In the private market, again, because of the balance of supply and demand there, we found we've been able, without loss of volume, to put through price increases in that market to be able to recover increased costs. So overall, actually, that's been a trend for us. That's been a favourable trend overall for the business, and we haven't seen dilution of margin due to those pressures.
Ben?
Yep, I think this is a industry with surplus of demand, which means that there is some command and control over the price point, and the government in this country has also recognized some of the challenges and also the need to reward and pay staff better. And that's why there have been year-on-year increases in investments in social care, now amounting to the new levy, which will allow for greater investment. Admittedly, some of that will initially go to the NHS, but medium to long term, that will affect how care is funded and supported in this country. And I think other countries also, even if you look at the US, I think the Biden administration are investing heavily in healthcare services in the home from a government perspective, because they all recognize actually there's quite a wise return on investment there. The more that's invested in the home, the less costly specialized services and hospitals become, because of the avoided utilization of those institutions and organizations. And then the private market, as James already outlined, I think you can increase prices and not actually see a drop-off on demand just because there is so much demand. Mm-hmm. I think there's a point around technology, which you're probably going to come on to later, but that also assists with margins, given that it can reduce the cost base of delivering services.
Mm-hmm. Actually, that would be my question. If it leads to lower EBITDA margins or not, technology assistive home care. But we can discuss it later if you have to add something about to answer the question, Guillaume.
No, there are different markets. The market is not just a single piece. It's not heterogeneous. There are different. It's not homogeneous. It's heterogeneous. There are the private. There's the market with the people that are paying everything by themselves. There's the market where the state is paying everything. So there are different markets and different answers. But on the whole, we are able to increase our prices because we are not able to decrease our margins. The margins in this industry are low. And so it's a human industry. All in all, the staff cost is around 80% of our turnover. So in the end, we are not able to lower our margins. So we need to, there is not a lot of different issues. The only solution is to increase our prices.
Mm-hmm. Thomas?
Yeah, so actually over the last 2 years, we've been able to increase our margins. And so you need to constantly look for increasing efficiency. So yesterday's challenges are today's routine. So that's how it works, I think, everywhere. So on the other hand, you also have the increasing demand. So the margin seems to be safe.
Mm-hmm. Thank you. So going back to the technology topic, I would like to ask you, what's the financial cost of using technology to prevent risk, for example, and who bears it? And does tech-assisted home care lead to lower EBITDA margins or not?
So it depends on what you mean by technology. So assisted technology is sometimes deployed, but often isn't brought together in the UK with home care. It's just not always commissioned in that way because the capital cost isn't funded by the government or by the NHS always. So our main thrust of the way we think about technology is we think about improving the quality of care, including improving the financial performance and improving the working life for the workforce, and we can get pretty immediate returns on that. So for example, on quality of care, the moment we put in electronic medicines management into our branches and our operation, we found the number of medicines errors, for example, just tumbled, just really comes down. So you can improve quality of care, and the data that you get out gives you far better insight to be able to manage quality and risks. I think what we're also seeing, though, is we deploy technology. We think about it, for example, automated invoicing. So a significant proportion of the technology investment that we've put into the business has been due to working capital improvement. So by improving working capital improvement in the cycle, by invoicing more quickly, because it all happens automated and electronically, we've improved our working capital, which has freed up several £1 million to invest into technology in the business. So we see direct financial improvement and more effective operating. And then the third area that's really important is back to workforce, and workforce being the important thing. It was really quite amazing to me when we rolled out, we've been for a number of years putting mobile phones and iPads into the people that we care for. And what was really interesting there was a shift of power and empowerment, because the care worker was suddenly empowered in a way that they weren't previously, to capture information and make changes to what they were doing. So suddenly their voice, when they might have rung up a branch and had to wait for someone in the branch to pick up the phone and write something on a post-it note, but suddenly there's an electronic record of an issue. That issue is coming back to the branch, that the doctor needs to be called, or that someone's family needs to be communicated with. Bang, it's in a queue, it's on a queue monitoring system. Suddenly the power is more with the care worker, and it becomes easier to do those things and provide great care. So that's the way we're thinking about technology. And does that add costs? Yes, it does. It does add costs.
James, we are a bit tight on time. Is there anybody else who wants to give his input in this?
Actually, what I could add is that technology is actually the key means to reduce the costs, and technology is present in all aspects of our activities. So when I started in ProMedica more than 10 years ago, I could see the end of so-called main database, and that was the biggest Excel file I could ever see. And I was kind of impressed how it was organized, but it was just not the right tool. Today, we are not in a different world. We are in a different galaxy. Yes? So with the system where all the data is gathered, where it has defined workflows, tasks, and everything is monitored automatically, mass payments, and even monitoring the speed of the minibuses on the highways and where they exceeded the speed limits. Everything is digitalized. All aspects of what we are doing. Without actually digitalization, if you don't do this, it's actually the growth barrier. I could observe this many times, because at some point the maintenance of the data is that problematic that it's a burden. Yes, it's a work which you have to do. So actually, in this business, I think technology is absolutely key.
Do you agree?
Sure. I mean, it's a business. You can think it's many human, but you cannot do this business only with a pen and a paper. You cannot do it. That was potentially possible in the last century, but not now. And that's why there will be a concentration of the in the sector, because you need to invest heavily on techs. On technologies, and all our employees, for example, they all have a smartphone with a full, with a limited data connection, because they are learning. They are learning on their phones. They have all their routes, the GPS, what they have to do, all the what you said about the logins, about everything, the monitoring, everything,
Yeah.
and it helps us invoice, pay much more quickly, everything.
Thank you, Guillaume. We're running out of time, so I think we'll have to wrap up this session. Thank you all for attending, and special thanks to our speakers today. It's been a great panel session. Thank you.